Hi, I'm Dr. Thomas Judge. I'm a gastroenterologist at Cooper Digestive Health Institute. And with me today is Dr. Cristina Capanescu. And she's also a gastroenterologist at the Digestive Health Institute. And we're here today to talk about colorectal cancer, risk factors, and how to reduce your risk for colorectal cancer.
Hi, how you doing? Thanks for having us. So this is a Facebook chat where we can let you know a little bit about our screening guidelines, the reason why we do this, and a little bit of what to look for when you're seeking help with your doctor. So why do we do this? Well, colon cancer is a preventable disease. It's very common, and the truth is not enough people are getting appropriate screening. So hopefully this can be an educational experience. About 1 out of 20 people will get colorectal cancer at some point in their lifetime. And colon cancer is actually expected to cause about 50,000 deaths this year alone. It's common in both men and women, and it's the second most common cancer killer in both men and women. But fortunately, the rates are actually dropping, and that's because we're doing a better job screening and educating both doctors and patients. But even so, the rates in the younger population are still going up slightly, so we'll talk a little more about that today too.
Okay. If you have any questions and you'd like to submit them, we're happy to answer them today. I'd like to talk about, you wanted to talk about the risk factors directly?
Well, yeah, we can talk about risk factors. So age is probably the one that's going to be most important. So typically we start screening at age 50. There are higher risk populations, and so the one worth mentioning is African Americans are at a higher risk, typically have more advanced disease when we start screening. So that's age 45 for routine screening. There are additional risk factors, and so family history comes into play, a personal history of prior polyps. And there are additional conditions like familial cancers and syndromes. And with Dr. Judge, who's a specialist in inflammatory bowel disease, that's also an additional risk.
Right. There are a number of different screening techniques that have been developed over the years. There are 3 particular screening tests that have been approved and are endorsed by the major societies, including the American Cancer Society, the American Gastroenterology Association, and the American College of Gastroenterology. And I'm going to discuss some of those screening techniques at this time. Probably the most effective screening test is a colonoscopy. This involves a bowel purge to clean out the colon, at which point a scope with a television camera is passed into the colon and advanced through the entire length of the colon. As that scope is withdrawn, the lining of the intestine is examined, and if polyps, which are precursors to cancers, are identified, specific instruments can be passed through the scope, and these polyps can then be removed. This is probably the gold standard in terms of screening for colon cancer. If done successfully, this test can be done once every 10 years for an adequate screening program. The other 2 tests that are similarly approved, one is called a FIT test, which measures blood in the intestinal tract. This is a stool-based test. It's usually provided by your primary care physician. This test is required on an annual basis, and if there is a positive result, we recommend a colonoscopy then to follow up and make sure that you don't have any tumors or any polyps present. The third test is known as a Cologuard test, and this looks for DNA abnormalities. Again, it's a stool-based study, and this is provided by your primary physician. This test can be done once every 3 years. And again, if there's a positive result to that test, we recommend a colonoscopy to follow up that study.
So why do we do all this? Well, what we're looking for are polyps. So as you know, the digestive tract, when you eat food, it gets mixed in the stomach, it passes through into the small intestine, you absorb all your nutrients, and then in the colon, which is the last 4 to 5 feet of the bowel, is where water gets reabsorbed and the rest is secreted as fecal matter. while the bowel moves through, it spends about a day or two in the colon, and it sloughs off along with the lining of the colon. Sometimes you get extra tissue, kind of like a skin mole, that slowly starts to grow larger and larger and may present a cancer risk. And so that's kind of how colon cancer presents in what we believe is the general lower risk population. Is you start to grow this little excess tissue, it starts to change, and slowly over a 10-year period becomes colon cancer. So what we're looking for when we go in with the colonoscope is we're looking to identify these polyps and remove them completely, thus removing the risk for colon cancer. And sometimes these polyps are benign, meaning they're not precancerous, but the way that we find out is we remove them, we send them to pathology, and then we follow up and decide when do we bring a patient back, because once you've grown a precancerous polyp, your risk for growing more and thus colon cancer risk all goes up higher. So that is the reason we're doing this. And colon cancer can be largely preventable. So we can reduce colon cancer up to 90% by doing these tests. And if you have questions as to when to come back for a colonoscopy, how often do I need them, what are my risks, we can address those things too.
Right. So when do we recommend that people start screening? Well, the incidence of colon cancer actually increases pretty dramatically after the age of 50. So for most individuals, 50 years of age is the starting point for colon cancer screening. There are selected populations of individuals who require screening procedures at an earlier age. These would include patients who have family members who have developed colon cancer before the age of 50, individuals who have siblings who may have also developed polyps at an early age, and specific populations such as those with inflammatory bowel disease. So patients with inflammatory bowel disease who've had this disease for more than 10 years, you are typically started on a screening program, and the rate of that screening program would vary on the type of inflammatory bowel disease that you may have. There's been recent introduction of an earlier age for colon cancer. Some societies have suggested that screening begin at age 45, and this has developed largely because of recognition that there is a group of patients who have been diagnosed with colorectal cancer at an early age. And so this age point is still under development, and while some societies have suggested using 45 as the starting point, that's not been universally established. Typically, we recommend that patients who have particular risk factors, that they discuss this with their physicians, and that if they have those risk factors, that screening be initiated at an earlier age. Certainly, if there's a family history of colon cancer before the age of 50, our recommendation is that you should have a colonoscopy performed at least 10 years before that person developed their colon cancer.
So what can you do to reduce the risk for colon cancer? And what should you look for if you are at all concerned that that might actually apply for you? So as far as the risks go, studies were done on multiple medications, diet, lifestyle factors, and the things that have been associated with an increased risk for colon cancer are being overweight. So BMI actually correlates to your risk for colon cancer. Your level of activity, so a sedentary lifestyle, could actually increase your risk as well. And as far as diet, obviously a diet that's rich in fruits, vegetables, high fiber is going to be beneficial and may actually reduce your chance for growing polyps and thus your overall risk for colon cancer, not to mention many other types of cancers and heart disease as well. A diet that's high in processed meats, in red meats, low in fiber is all a significant increased risk for colon cancer. So we do try to educate our patients in the office about that as well, in addition to the screening.
Yeah, other lifestyle issues that are associated with higher risk for cancer would include smoking, which is a risk obviously for other cancers, and alcohol. So a heavy intake of alcohol does increase your risk for colon cancer as well.
And so that's actually 1 drink a day for women and 2 for men. So not even heavy, but just what some might consider regular, moderate social intake is
Right.
still a risk.
In terms of screening programs, there are some free cancer screening programs that have been introduced. Cooper has introduced a program particularly for patients who are uninsured, and this is available through the website at cooperhealth.org, and more information is available if you'd like to review that.
And if you're interested more in scheduling colonoscopies or seeing your doctors, we can certainly advise you and link you to the appropriate site. Some of us don't just practice out in the Mount Laurel facility, which is where we are now, and that is our main center for doing procedures and seeing patients. But we go to Camden, Pennsville, even affiliation with Salem Hospital for our patients. That's more convenient. And we also do office hours and procedures in Willingboro. Procedures anywhere else? I think that's it.
That's it for procedures. Yep. We have offices also at the RIPA Center and at Sewell.
And Sewell. So let us know if we can answer any further questions. And if you have any specific questions that maybe we can answer during this chat, feel free to send them over.
Okay.
So thank you so much
Thank
for
you very
joining us, and we'll be looking forward to your comments and questions.
Thanks.